It is a dangerous and violent environment, and it's taxpayer funded. In a series of exclusive reports, ABC 15 investigator Dave Biscobine exposed serious problems with safety and security at the state mental hospital. And tonight, he's learning about a patient's gruesome death this week, and it might be the tragic consequence of the issues we've raised.
On September 27th, Christopher Paul Blackwell would have turned 24. He didn't live to see his birthday. Blackwell was a young man with serious mental illness, committed to the Arizona State Hospital for the last 2 years. According to hospital officials, it was just after 10 p.m. Monday. Blackwell collapsed in his room inside the Ironwood unit. A spokesperson from the state health department provided the ABC 15 investigators with an official statement about Blackwell's death. It says, hospital staff observed the patient collapse and immediately initiated emergency medical response procedures. Blackwell was transferred by ambulance to the emergency room of the Maricopa Medical Center. He was pronounced dead at 3:40 a.m. Tuesday. But insiders tell us there's more to this story. Chris Blackwell had a history of swallowing dangerous objects. He wasn't suicidal, but experts say some patients cut themselves or swallow things to relieve stress. Now, multiple sources tell us that Chris Blackwell was a one-to-one patient. That means he was supposed to be monitored closely by a staff member 24 hours a day, 7 days a week. The official cause of death has yet to be determined. But sources tell us Blackwell had lacerations to his colon and small intestines. In the past few months, sources also say, despite being closely watched, he had swallowed pieces of a broken CD and a piece of an eyeglass frame. Insiders claim that because of low staffing levels and a dangerous environment, it's difficult or impossible to provide adequate care for patients like Chris. They point to high levels of staff turnover and increasing violence at the hospital as factors.
There should be at all times 2-3 techs on the floor.
We spoke to numerous insiders like this person who actually treated Chris Blackwell.
It actually got to the point where almost every single day I'm on the floor alone. There's many days I will be on the floor alone. Other staff members will be on the floor alone.
This insider and others told us how heartbroken they are over Blackwell's death and how much they liked him.
You just never knew on any given day what was going to happen, or even any given moment.
We're trying to find out if police are investigating Chris Blackwell's death. And as for the hospital, administrators are conducting their own investigation. And we learned one of the things they're trying to figure out is who's talking to us. But we're going to stay on top of this story, and we've already requested all of the files and reports related to this tragedy. I'm investigator Dave Biscobine, ABC 15 News.
And to see Dave's previous reports exposing the shocking level of violence at the state hospital and a startling number of escapes, go to abc15.com/investigators.